Remember, the veins are going back towards the heart. You have a left subclavian vein with an external jugular vein. They will merge to form a left brachiocephalic vein.
A little higher.
Left brachiocephalic vein. You have the same thing on the right side. So you have the right subclavian here with the right external jugular here to form the right brachiocephalic vein here. The two brachiocephalic veins will then merge, blend to form the superior vena cava, which then goes into the right atrium. When you look down here, same kind of thing. You have essentially a left external iliac, and there is a, buried in here, there's a left internal. There's a left internal. They will merge to form the left common iliac, which the two iliacs, the right and left commons, will then merge to form the inferior vena cava up in here. You have the renal veins here, which dump into the inferior vena cava, and again, go up towards the right atrium. Arterially, you can see again through this, through a little bit of clarity here. This is the left subclavian artery, right? And it comes directly off. This would be the aortic arch. It doesn't show it that well, but off the aortic arch is the right brachiocephalic trunk. From the right brachiocephalic trunk, we have the right common carotid artery, and then the subclavian artery running this way. Well, the left subclavian, common carotid and the left subclavian come directly off the arch here. We have the thoracic aorta coming here. Once you pass the diaphragm, you now have the abdominal aorta here with a celiac trunk, which gives off 3 vessels. We'll talk about those later. A superior mesenteric kind of runs over the renal artery and vein. The inferior mesenteric here. Once you come down to this split, well, now you've got the right and left common iliac arteries, which will then split into an internal and an external. You get to the inguinal ligament, and now you're talking about the femoral artery and vein. Let's go to a different model. We look at this one here, right? And you can see it up in here. Here you have the common iliac artery here, giving off an external and an internal. When you look at the veins, you have external iliac vein, internal iliac vein, which will merge to form the common iliac vein, and the two common iliacs will now merge to form the inferior vena cava here. Again, this is a little bit harder to see because it's obscured by the musculature here, and that's why I like the other model for that. Here's the aortic arch here. You can see the brachiocephalic trunk here with the left common carotid and then the subclavian kind of coming up this way. Okay, now let's look at if you just look at the down in here, so you can see the vein a little clearer. So this is the femoral vein, and it's kind of running up this way, right? And the external iliac vein here. Well, what happens is you get the greater saphenous vein running up and dumping into the femoral vein, but just before it goes across the inguinal ligament, which again, once it crosses the inguinal ligament, it now becomes the external iliac vein. Let's look at look at, again, external iliac artery, crosses the inguinal ligament, is now the femoral artery. The femoral artery gives off a deep femoral branch, as well as a lateral circumflex with an ascending and a descending branch. But if you look this way, and it's hard to see again because it's a model, as you come through, there is a medial circumflex here.
The closer everybody gets, the harder it is for everybody else to see.
Yeah, no,
yeah.
the
Try not
cameras
to.
the phones are annoying.
Yeah, try not to get too close because you obstruct everyone's view. This is the medial circumflex here. Okay, these are perforators, but this is medial. So again, you're looking at it here because now this one is rotating this way, and you can't see because it's can't get through the muscle, but running this way is the medial version. So here is the lateral circumflex, right? And here's the medial coming off this way. And then again, once you come up with the lateral femoral circumflex, you get an ascending branch and a descending branch. Deep femoral here. Now, you follow the femoral artery as it goes through the hiatus, and as it comes out, right, it becomes the popliteal artery. The popliteal artery gives off superior and inferior geniculars, again, medial versus lateral, but you get the geniculars here, superior and inferior. Well, once it comes down here, the popliteal eventually branches into three main arteries. The posterior tibial artery here, along the medial malleolus, right, it runs behind the medial malleolus. You have a branch here, which pierces through the muscle, comes up here. This is called the peroneal artery on the lateral border, right, the pinky side. And then you have one that goes through here, it ducts into the, remember we talked about the interosseous membrane? Well, between the tib fib, there's that interosseous membrane, and it shoots out here, and this is the anterior tibial. The anterior tibial will give off malleolar branches and perforating branches, so the whole ankle is kind of circumscribed. Anyway, it comes down here, and eventually it will give off what's called the dorsalis pedis. We've got an arch. Again, you don't really see it clearly up on here. Metatarsal arteries, right? There were 5 metatarsal arteries, just like there were 5 metacarpal arteries. And then once you get to the web space here, right, where the base of the digits, it gives off digital branches. And again, not as clear on this as it was in the hand. Okay, let's look at the hand for a second.
You don't have Zoom on your phone? You don't have Zoom?
Oh, I'll check it. Yeah, I do.
Okay, axillary artery here, right, forms the brachial artery, right, here's brachial. Then it will split into a radial artery and an ulnar artery. Also coming off this, the ulnar artery here is what's called the common interosseous artery, right? Some people use the word